The fentanyl crisis is reaching every corner of our country and across Minnesota. The highly addictive synthetic opioid is stretching investigative resources and devastating families. We take a look at the epidemic from the inside, talking with families experiencing deep loss.
But he didn't ask for or choose fentanyl.
Hearing who it's impacting and looking for solutions.
WCCO investigates the fentanyl crisis.
Hello, I'm Jennifer Mayerle with WCCO News. We start with the problem. Last year alone, the Drug Enforcement Agency seized the equivalent of more than 387 million lethal doses of fentanyl. That's enough to kill every person living in America. We investigate how it's getting to our communities and what's being done to stop it. These are the fake prescription pills, powder, and packed bricks being taken off the streets in Minnesota. The danger inside? Fentanyl.
It's the most addictive drug we've seen. There's nothing else like it.
Justin King is the special agent in charge of the Drug Enforcement Agency covering Minnesota.
We're seeing it in both fake pill form and we're seeing it in a powder form. We see it in fake pills that are made to look like a regular prescription drug, whether that be an Oxycontin or a Percocet or a Xanax. We see fentanyl mixed into other drugs even. We see it mixed into methamphetamine and we see it mixed with cocaine.
In the last year, DEA lab testing found 6 out of 10 fentanyl-laced fake prescription pills contain a potentially deadly dose of fentanyl. 2 milligrams, or the amount next to this quarter, is enough to kill someone. Let that sink in.
You're talking about something that's 50 times more potent than heroin. And so just a small amount of that fentanyl can be something that ends somebody's life.
King says Mexican cartels are responsible for mass-producing products containing fentanyl.
The 2 main cartels in Mexico, the Sinaloa cartel and the Jalisco cartel.
Mainly getting chemicals from China to make the synthetic opioid, then pushing products into the U.S. using transportation routes through vehicles and packages, getting it to drug traffickers, with some deals done over social media. What do they get out of it if they're putting potentially lethal doses of fentanyl into these pills?
Well, one would always ask that question, wouldn't you? But the cartels, it's all about making money. And so what they want to do is they want to create a product with the minimal amount of money they have to put into it that's potent, creates addicted people, and they push it in. And they will ruthlessly try to expand that business model into every community.
What the DEA stops from getting to a community, they test in a lab. So does the State Bureau of Criminal Apprehension. This is the BCA's Forensic Science Services Drug Chemistry Lab. So what do you do in here?
We analyze evidence suspected to contain a controlled substance.
Supervisor Eric Grumwald walks us through the testing process.
She is adding the color test reagents to the color test spot well. It gives her an indication of what might be in the sample. That would be characteristic of potentially fentanyl, possibly cocaine.
A sample then goes through an instrument for confirmation. Grumwald says fake M30s laced with fentanyl, made to look like legitimate oxycodone tablets, are common, and says it's a huge public safety threat.
The users don't necessarily know what they're buying, and it has a very high potency. It takes a very small dose to be fatal.
The amount found in Minnesota and tested in here continues to climb. The lab went from 115 fentanyl cases a year to 115 a month. Now roughly 1,400 cases a year.
We receive overdose cases on a regular basis.
Testing allows them to alert people when there's a deadly product going around. It's also critical to holding someone accountable in court. But the overarching goal is to stop the distribution of fentanyl, to save lives. What can make a difference?
Everybody we arrest, every investigation we do makes a difference. Every time we take drugs off the street or we indict somebody, hold somebody accountable, it makes a difference.
You said disrupt, destroy the networks.
We want to defeat the Sinaloa and Jalisco cartels. Every time we take these pills off the street, then we're potentially saving those lives.
The fentanyl crisis doesn't discriminate. It touches the youngest Minnesotans, and its hold spans across demographics. Fentanyl poisoning and overdose deaths skyrocketed in the last few years. Some of those are children. It's making headlines in Minnesota. 2 charged in the fentanyl-related death of a 17-month-old in Ramsey County. A Maple Plain mother charged with manslaughter after her 6-year-old son chewed on a drug-tainted dollar bill. A 7-year-old in St. Paul dead from fentanyl poisoning. A 1-year-old in Minneapolis.
To be clear, opioids in children it's a deadly mix.
Every year, calls of kids exposed to fentanyl into Minnesota Poison Center climbs.
If there are any kids, even one kid, exposed to fentanyl, it's a big problem.
Dr. Travis Olives is an ER doc at Hennepin Healthcare. He's also the Associate Medical Director of the Minnesota Poison Control System.
We need to keep these substances out of reach and out of sight of kids that are cruising.
Kids like to get into everything.
They get into anything they can, and their natural inclination is to get it in their hand and put it in their mouth.
Olives warns time is critical with any exposure.
The way that opioids cause people to die is by stopping them from breathing. And we have both naloxone or Narcan, which treats that very well if it's given in a timely fashion.
He says performing rescue breathing while waiting for help can also save a life.
This is a very time-sensitive treatment where we know that if we can keep somebody breathing or restore their breathing, their likelihood of doing well increases exponentially.
We also have the crime lab coming through here.
Dr. Andrew Baker sees the other side of things when help doesn't arrive in time.
The drug market is just getting flooded with fentanyl. It is the #1 driver of our increased caseload in our medical examiner's office.
Baker became the Hennepin County medical examiner nearly 20 years ago. He's witnessed the meteoric rise of fentanyl, with 4 fentanyl-related deaths in 2013 to a historic 440 last year.
All of these deaths are, at some level, obviously preventable. The other thing that concerns me is there doesn't appear to be any end in sight to this epidemic.
His office had to increase staff from physicians and techs to investigators and support personnel. And the crisis caused them to curtail autopsies on apparent natural cause deaths, which Baker calls a public service and good for public health data.
Which is really a tragedy because the only reason you go into this line of work is because you want to help families. You want to give them the answers.
Baker says the fentanyl crisis touches us all. He may see it more than most, delivering toxicology reports to often unsuspecting families. That's not lost on him.
And one of the things you think about when you make those calls is, there but for the grace of God, I could be on the other end of this call.
Another drug mixed with fentanyl is making it even deadlier. Narcan doesn't work on the sedative xylazine. Coming up next, meet the loved ones left behind, how families are grieving and transforming pain into purpose. Welcome back. We're getting an inside perspective from the families who have lost a loved one to a fentanyl overdose or poisoning, mothers and fathers who have buried a child, a fiance riddled with guilt. We brought 5 families together to learn about the loss and the reality of the fentanyl epidemic.
Our son Jaden, he was 14. We lost him in January of this year. Shoot. He was the sweetest, kindest boy ever. He would go out of his way to help anybody.
Devin was 19 years old when he died. He was the jokester of our family. He was the laughter of our family.
Fiance Ryan, he was 34, and he had an outgoing personality, and he just lit up the rooms everywhere that he went, always bringing a smile to people's faces.
My son's name was Lawanye. He was 20 years old. He was a really sweet young man. He was kind. He helped me beat cancer.
Zalea, she was 17. She's a beautiful, beautiful young woman. She was kind of like our mother hen. She would oftentimes, be doing a lot of things for everybody.
Can you talk a little bit about what was going on in her life at the time that this all happened?
She had a lot of loss herself, really just struggling emotionally with trauma and pulling herself out of it.
I see some of you nodding. What are you feeling as Josh is saying that?
A lot of Jaden was the social aspect of it, wanting to fit in.
My son made a choice to take a Percocet for a headache. Was it right? But he didn't ask for or choose fentanyl.
Lawanye had just moved into his place. He passed away from fentanyl marijuana.
What does that mean?
It was laced. His marijuana was laced. Then he went to sleep and he didn't wake up.
And what about with Ryan? I know he had had substance abuse issues.
Brian had just recently gotten out of jail 30 days before he passed away. Like 2 years before that, his brother died of a heroin overdose. And when he came home, he immediately went to use because he didn't know how else to deal with it, and then was given fentanyl under the assumption it was heroin. It's one of those things that you hear about it, but you pray that it's never going to happen to you or to your loved one. And so it's very shocking. But then at the same point, it was not shocking because it was everywhere.
Had you heard of fentanyl? Did you know that your kids could have?
We didn't. We had no idea.
And we had the conversation with Jaden, you know, over and over again.
Had anyone else had conversations like that about fentanyl or about drugs in general?
I teach opioid overdose, so we had the conversation. His was an accidental overdose, so he didn't know it was there.
For her, it was a half of a Percocet, that she thought it was a Percocet. She had a headache. We think, after the fact that she'd been dealing with things, kind of getting away with taking pills, self-medication.
And Devin located this via Snapchat.
Via Snapchat, yep.
Anyone else have a social media connection?
Yes.
Yeah.
You name it, they use it. The dealers do.
In our case, it was they were messaging on Messenger and on Snapchat.
These families, connected through loss, now finding ways to turn that pain into purpose. Tara Newfer is just getting started, warning people about the dangers of fentanyl.
I never thought that this would be my journey ever. I'd rather have Jaden back, but that's not a possibility.
The mental toll that it has taken on all of our health, especially my youngest son, because he's the one that found Devin. There's the guilt of not knowing enough, not being educated enough.
Noring's family is educating others through a nonprofit in her son's name.
Our lives go on, but they don't go on. And unless you've been through it, it's like you don't understand what it's like. If I would have done one thing different, would he still be alive?
Emerson started a memorial tree at a treatment center and is involved with Narcan training and advocacy. Josh Gretz and his family started Families Fighting Fentanyl, highlighting lives lost to the crisis and helping pay a portion of funeral expenses.
Our 6-year-old daughter and my wife found Zalea. And there's just so much to that. Everyone in our family, they all have their own way of working through it or living with it.
He was my best friend. He was my hero. He didn't deserve that. None of the children, none of the people out here deserve what's happening to them.
Latrice Shaw teaches overdose prevention and is training to be a peer specialist. What do you want other people to know that maybe felt how you felt before this, that it's not going to happen to me, that I'm not going to be touched by fentanyl in this way?
That's just not true. I mean, we didn't think it was going to happen to us, but it did, and it could.
The whole not my kid, I was that mom.
It's in everything, pills, powders, edibles, whatever you're ingesting. For us, it was we really didn't think that she would take a pill, but she did.
It doesn't discriminate, it picks anybody.
Educate yourselves, your children, your family, your neighbors, anyone that will listen.
What does that mean to you to be doing this work?
For me, it honors my son. And it helps prevent other mothers, families, from going through what we're experiencing right now.
Someone has been charged in 2 of the 5 cases. The criminal cases are working their way through the court system. Next, examining a solution, how a thin strip of paper may save lives, and a story providing hope for those living with addiction and in recovery. We've shown you the impact of the fentanyl crisis gripping our communities. Now we examine a solution. Caroline Cummings reports on a thin strip of paper that can help save lives.
She had been married 8 years and loved her job and seemed to have a very successful life, many, many, many friends.
It's undeniable how much Mark and Brenda Weeger adore their daughter Jessica.
I hope that she knew that she was the beauty in my life.
But last July, the Weegers received a devastating call. Their beloved Jessica had just died of an apparent cocaine overdose.
It's like, no, that can't be. That's, our daughter doesn't use cocaine.
They learned later it was laced with fentanyl, 27 times a therapeutic dose. And soon they were haunted by how it could have ended differently.
One of Jessica's best friends came bursting through the door, and she was full of tears, saying, I'm so sorry, I'm so sorry. Jessica sent me a text message at 11:30 at night saying, where can I get a fentanyl test strip? And she said, I didn't get that message until this morning.
Fentanyl test strips can detect the presence of the lethal drug in other kinds of drugs, a harm reduction strategy that can save people from the deadly opioid and spare their loved ones an unthinkable tragedy.
I went to my Google search and asked the question on Google, where can I find fentanyl test strips?
The answer, they weren't easy to find, which baffled the Weegers. Why wasn't this life-saving tool readily available? Now they had a new purpose.
Nobody needs to die from an opioid overdose, and access to these life-saving resources is so imperative for keeping people alive.
The Steve Rumler Hope Network has distributed tens of thousands of them. It wasn't until 2 years ago that they were even legal in Minnesota.
What you'll want to do is get 10 milligrams of the substance.
That's enough to cover Lincoln's face on a penny. Then you dissolve it in 1 milliliter of water, which is about a quarter of a bottle cap. There's 2 single-use strips in one of these packs.
Dip the bottom here into the water, and I'm going to keep it in there for about 15 seconds.
1 line means positive, 2 means negative, and there's a QR code in these packets for users to answer questions. What the Hope Network found is they work.
And we found that 91% of people that report that whatever substance they intended to consume test positive for fentanyl report some change in behavior. So either getting rid of the drugs entirely or using safer use strategies, like not using alone, making sure naloxone is present, and other things to help prevent a potentially fatal encounter with fentanyl.
The Weegers want to see these test strips available in more places. It's why they lobbied the legislature to require them in cannabis dispensaries that are coming to market soon. The law doesn't mandate them, but it does allow dispensaries and liquor stores to sell them when they couldn't before.
It would be important for her to know that, what could help others be safe if that's a result of her being gone. She would want that.
In Minneapolis, Caroline Cummings, WCCO News.
In many states, fentanyl test strips are still considered drug paraphernalia and are therefore illegal. They cost as little as $1 per strip. To access them for free, visit our website. Now to a story of recovery and hope. How one person survived an opioid overdose and why he wants to help others in recovery.
The beginning of everything was when I was really young, probably 12 or so. I was introduced to prescription painkillers. It was just experimenting. I grew up in an awesome household, loving parents, loving family. It was literally just, hey, you want to try this? Sure. And the first time I ever took them, I was like, okay, I don't ever want to not feel like this ever again. At a certain point, it just became too expensive to do it the prescription way. And then that's what eventually led me to try essentially the same drugs, but the street version of those drugs. I was homeless. I couldn't hold down a job. I was committing crimes.
Derek Johnson said he tried most drugs. While fentanyl wasn't as widely known then, he suspects the synthetic opioid was mixed in with some of them.
I have overdosed 9 times.
Do you remember what it felt like to overdose or coming back after it?
Yeah, so sometimes it was just like I didn't even know. And then there was actually a time where I remember my mind was still conscious for a little bit of it, and I could hear my friends screaming at me. I could hear them like slapping me, but I couldn't feel it. And I was like mentally conscious, but I couldn't breathe, I couldn't talk.
How did you survive 9 overdoses?
If it wasn't for naloxone, I would not be alive today. Each time it was like, like a wake-up call. Every day was trying to quit. Every day was the day that I'm going to stop doing this. And then the withdrawals from the drugs kick in, and now tomorrow's the day.
Johnson willingly went to treatment 8 times. His first, 7th, and 8th time was at Hazelden Betty Ford.
There's usually an event that occurs that causes someone that day to reach out for treatment when they weren't reaching out the day before that.
Lydia Burr is the director of clinical services in St. Paul, where Johnson went for aftercare.
I think it's so important that people know that there is hope for recovery. No matter what's happened, there is hope for you in recovery.
She says there are treatment techniques and effective ways of treating addiction.
And although it's a chronic and progressive and fatal disease, it's one that somebody can actually make a complete recovery from.
Treatment includes family education and leaning on a support network.
Because the disease of addiction really breeds in isolation, what we really want to focus on is connection.
Johnson found that there was a window of time in his recovery where he gained some of what he had lost: a job, family trust.
Having that little glimpse really allowed me to see that the struggles in the early stages of recovery are worth going through.
That 8th time in treatment stuck.
I found a really solid group of people. I made a lot of friends and more like family. And we found ways to have fun. We found ways to support each other. One of those people is now my wife.
Johnson's been sober 9.5 years. During that time, he's watched the fentanyl problem evolve into the current crisis.
It's even deadlier than the things that we already thought were the most deadly things out there. And that's just terrifying.
And I know you've had loss tied to fentanyl as well.
Yeah, last year I lost my brother to a fentanyl overdose, and 2 of my cousins in a 5-month period. Why did I get to get out and they didn't?
Still, he wants others to know recovery is possible.
When you're in it, it seems impossible. And it is, until you realize that it isn't.
What would you tell him about getting to the other side?
It's so worth it. And it's possible.
Resources are available on our website, WCCO.com. Thank you for joining us. I'm Jennifer Mayerle with WCCO News.